So, miracle drug. A quote miracle drug is going from free to $375,000 a year, if you haven't heard. At the surface, this looks not so good. So let's dive deeper into it. Jacobus, now if I say any names wrong, just like pretend I didn't. But Jacobus Pharmaceutical developed a drug called 3,4-DAP, DAP, that seemed to treat the critical condition Lambert-Eaton myasthenic syndrome. Now I have to say it again: Lambert-Eaton myasthenic syndrome, which causes fatigue and weakness in muscles by causing the body to attack its own tissue. It's an autoimmune disease, is what it is. Jacobus Pharmaceutical decided to not to undertake the expensive clinical trials to get this drug approved for sale, but instead decided to give it away to hundreds of people through the FDA's Compassionate Program. Pretty cool. And they've been doing this for over 2 decades. The issue, though, is a Florida drug company, Catalyst Pharmaceuticals, bought the American rights to market a very similar drug, which is already sold in Europe. Catalyst did the studies, paid the money, jumped through the hoops necessary to gain federal approval. And in doing so, the FDA granted them orphan drug status, which is, well, this means that no one else in the country can make this drug for the next 7 years. So now 3,4-DAP is known as FIRDAPS, funny name, but FIRDAPS. And this is problematic because hundreds of patients were getting this treatment for free, absolutely free. And now it's $375,000 a year. Now, Rebecca Hovd, again, I apologize if I am butchering anyone's names, but Rebecca Hovd said she is willing to pay for her medication. But $375,000 is 3 times the amount of the worth of her home. Right. Hovd contacted her uncle in Vermont, who contacted his state senator, Bernie Sanders, who is now on this shit like Velcro. He spoke to a Hovd over an internet call, and they discussed the matter at length. Hovd told Sanders that even if her insurance covers the cost, those costs would eventually end up higher, or end up in like higher insurance premiums and taxes. It's in quotes, it's going to affect everyone. Also in quotes, she said that many people are even saying they're going to give up. That breaks my heart, she said. That breaks my heart too, because when you have this kind of autoimmune disease, reminding you if you haven't read it 5 times like I have, it attacks their own tissues. It makes them feel fatigued. They don't want to get out of bed. It's I think it's kind of similar to I can't remember what it's called. Starts with an M. What am I thinking of, Christy?
Starts with an M?
M, yeah.
Huh.
I'm sorry, everyone. But I'll think of it and I'll just shout it in the middle of someone else's story.
I like it.
Yeah. But yeah, so it just keeps you down. And Rebecca Hovd has kids. So this this medication not only just kind of helps her out of bed, it really, really helps her. It like lets her keep up with her life and keep going. And anyone else who has this Lambert-Eaton myasthenic syndrome, it's so hard to say. I know it's harder to have, but it's also hard to say. I'm sorry. And it's so for people to say that they're going to give up, that just means they are giving up, because I don't want to jump around too much here in my main story. But she said if she doesn't get her medication, because she was offered by Catalyst Pharmaceuticals a free 30-day trial, which is cool, great. What's she going to do after 30 days, right? When for a year of this prescription is 3 times the amount of her house, right? So if she doesn't get this medication, she will literally not be able to breathe. So she'll have to go to the hospital, and that will rack up her medical bills. And then again, she won't be able to afford this medication. So I didn't want to focus too much on the personal story, and I'm sorry, I did. I want to stay pretty objective at this. So I'll move on just a little bit here, and then I'll be done. Senator Sanders wrote an aggressive letter to Catalyst Pharmaceuticals asking them to justify their outrageous price and plans for the drug. Catalyst released a statement on Monday saying that improving patient care is the top priority, and thousands of more people will be able to get access to this medication. A spokesperson for the company said that most patients will be able to get the prescription with a $10 copay. But as I mentioned above, we know that this will have to be made up for, and not everyone gets covered for every drug. This is still a problem. Their stocks did drop by several points, though, after Bernie Sanders released his letter. Excuse me. Bless you. It's not worth noting, or I'm sorry, it's not worth noting. It's worth noting. I read that other politicians have expressed outrage over this matter, but I haven't seen who yet. This is legal, though. What Catalyst Pharmaceuticals has done by buying the rights to this drug and picking their price, no matter why, from what I know, it's legal. But it feels like a monopoly, right? And monopolies are illegal, as far as I know. Maybe I'm off my rocker. So my question to the viewers here are: does legality equal morality? And is this a downfall of capitalism? Chrissy, what's your thoughts on this whole thing?
So this company comes in and then buys the rights to it. So are they now manufacturing it, or are they paying another company to manufacture it? That's what I couldn't find when I looked up the story. I just don't see how they can live with themselves, how they can look at themselves in the mirror, how they can sleep at night knowing that this one drug was free and now it's over $300,000 a year. You know, 70% plus Americans don't make $300,000 a year. It's a shitty story.
It really is. It's really, really sad. And I mean, my only answer to that is I'm sure this is not the only drug that they sell that affects people like this. This is a normal routine, I guess, probably for pharmaceutical companies. This is no really like new story. It's a new drug that this is being done with. But one of the things that really gets me is that there is a pharmaceutical company. I mean, I don't want to say country. Company.
Yeah, that's us, the country.
Yeah. that was giving this away for free for 2 decades. And they have been forced to stop production and giving it away to people who like can't afford it. And it's not just that people want a handout, right? Rebecca Hovd said that she is willing to pay for her medication. Like, who wouldn't be? I guess some people feel entitled. Like, there is a stereotype there for a reason. I believe stereotypes are there for a reason, but that doesn't mean everyone fits the stereotype, right? So we need to like show some compassion and realize that, hey, this is fucky, right? This is fucky.
Yeah.
That is all I have for this specific
Medicare
story.
for all.
For all would really help. And I think I've said it in one of the first episodes we had, but just get rid of fucking health insurance companies. Just like get rid of that middleman, and then
100%.
the pharmaceutical countries can deal with the hospitals and or the government as the government deals with hospitals. Because like, I trust the government
as
more.
every other country does.
Yeah.
All of them.
Developed
all of
country.
them.
Yes.
Yeah.
And it's
and
just,
some not.
Yeah. So that's my thoughts. That's my thoughts. But if you guys have other thoughts, please let us know down in the comments. Also, you can let us know during the show here in the live chat. But as you know, I'm kind of shitty at watching live chat. But please don't feel like you can't talk to us. But please share your views because I'm interested in hearing them.